Lower eyelid. A lot of people get puffy lower eyelids. Some people get to where the eyelid falls out. You called it ectropion, I think?
Ectropion, that's correct. That's where the eyelid margin itself, that's the basically top or the edge of the eyelid, is turned outward away from the eye, and that could lead to multiple problems, including drying out of the eye, but it can also lead to tearing, where tears are pouring down the cheek, because the tear drain sits in the middle corner of the eye, and that helps drain the tears away from the eyeball. If that's not in the correct position, tears are going to well up and then overflow down your cheek.
So is it an easy problem? What do you do to fix an eyelid that's falling down, I guess, the lower eyelid?
So with ectropion, with the eyelid turned out or fallen down, the most common surgical procedure is an ectropion repair, in which we make an incision on the outer corner, that's about here on the eyelid, and we essentially are tightening the eyelid horizontally. The most common cause of that turning out of the eyelid margin is a laxity of the eyelid. So if we tighten it, we usually get a great surgical result.
I've heard of a loop procedure. What's a loop? Is there a loop procedure for the lower eyelid?
So the real procedure for the lower eyelid is actually a lateral tarsal strip, and that may be something along the lines of what you're referring to.
Lateral tarsal
strip.
What does that mean?
That is just taking that lateral tarsus, which is basically the fibrous plate that is the structure of the eyelid margin, and making a strip of it at the outer corner and pulling it and reattaching it to the bone at the outer corner of the eye socket. That's what gives you that tightening in that ectropion repair.